now we are going to get started. And I want to start off with a quick check in with my main man, Dr. Reynolds. Dr. Reynolds, last 2 weeks ago, we had Thanksgiving. Looked like we had a little dip in rates of COVID cases. And in fact, people like you and I know that was just an artifact of fewer people went and got tested. Many of the centers were down. When we look at the numbers this week, lo and behold, what we found is that, in fact, the numbers have gone up. They continue to go up. Somehow people seem to have forgotten and thought, oh, it was a surge. Nope, we're still on an increase. So can you just say a few words to us about what's happening in our community as it relates to COVID and what we need to be doing to keep ourselves and our families safe? Yeah.
Even if you're vaccinated in a public space, wear your mask. If you're around someone who's immune suppressed because of a medical condition, transplant, cancer treatments, wear your mask around them for their protection. But vaccination is the key to prevention. And then add those other layers on.
Got you, Dr. Reynolds. We had a little teeny bit of a glitch with our Facebook Live, and I got you on speaker now so that the people on Facebook can hear you. Everybody on the radio could hear you, but some of our good people Facebook Live who look forward to hearing from Dr. Reynolds could not hear you. So your recommendation for folks, keep those family gatherings small. If you have any symptoms, go get tested. And if you have any known exposures, you've been around, you came into a place and people weren't masked, or you were at an event and as the event moved, carried on, people removed masks, and you sort of look around and find yourself in a place where lots of people aren't honoring protocols, that people should go and get tested and continue to practice prevention. Can you just, and I know it might sound like I feel a lot like a broken record, but can you just recap for us, what does good prevention look like? So you said, first of all, get that vaccine, get those boosters. What else should people be doing?
When you are in a public place, keep a mask on. When you are in a private space, and you don't know the people, or there's someone who's immune suppressed because they're taking special medicines because they had an organ transplant, or they're getting cancer treatments, keep your mask on. If there's unvaccinated people in that household, keep your mask on. That's for everybody's protection. When we can, do things outside. And I know that sounds crazy in this weather, but at least have the room ventilated. So it might be a little cool if you crack the window, but you don't want to be in a crowded room with people smoking shoulder to shoulder and people aren't wearing masks, which comes to the next point. Maintain some physical distancing and don't invite everybody to your household. Try to keep it down to one, ideally one other family where you know everybody's vaccinated, where you know people are going to wear their masks, and you know people aren't sick. And that does lead to a point that I didn't mention earlier. Before your guests come for holiday gatherings, ask them, have they had a fever? Have they had cough, rapid breathing, loss of sense of smell and taste? Ask them if they've had any symptoms. And if they have had fever and those things, tell them today is probably not a good day for you to come visit. When you hear that they've been sick, say if it happened today, around 4 or 5 days, go get tested. If you're already having symptoms, get tested. And sometimes when that test is negative, you should repeat it in about 5 days. I didn't mention travel initially, but if you're traveling, what I typically do is 4 to 5 days after I come back from the trip, I go get tested. And it's important to check the county website to see where the testing facilities are going to be open during the holiday season. So you need good information. So if you go to the county website, if you call your local drugstore chain, that includes Rite Aid, CVS, Walgreens, Myers, Kroger, find out where you can get tested and where you can get vaccinated and make a plan. You know, that's Dr. Verholden's major theme, make a plan. And during these holiday seasons, you must have a plan. Now, let me go to non-COVID stuff, because there's other things out there too. The holidays are coming. Make sure you have refilled all your medication. If you have a change in your condition, be it diabetes, hypertension, be it chest pain, check in with your doctor before the holiday shutdown comes so you know you have been reevaluated, you have refilled your medicine. You're not calling on Christmas Day saying, I ran out of my blood pressure medication or I ran out of my insulin. Do it now to make sure you have a supply to make it through the holidays. And know what urgent care center your doctor uses, know what hospital and emergency room your doctor uses, and stay in contact if your condition changes.
I got it. That's good advice, Dr. Reynolds. Great advice. Make sure you got your medications. And the thing that makes me think of is if people don't have medications themselves, check in with your loved ones. Check in with some of those older loved ones, especially, or people who don't have transportation. And that might be a way to be supportive of people during this time period, making sure that they have everything that they need, given that they might not be able to go out or access some of those services. That's really great info, Dr. Reynolds. Thank you so much. We are going to come back to you. I want to flip over real quick now and talk to Dr. Stozier. Dr. Stozier, you've got so many great things happening in the City of Flint through the Community Resource House. Welcome to the broadcast and good morning.
Good morning, and thank you so much. We're always excited about the programs and services that we provide for residents of the City of Flint, in addition to the residents of Genesee County. So it is a blessing to be able to have the funding, to be able to answer the needs of the residents, and to be able to successfully partner with many community organizations in order to bring these programs into fruition. So one of the programs that I would like to speak about is actually a facility. It is called our Chia Community Resource House. And a lot of people say, well, what in the world is Chia? Well, Chia spelled CHEA, and it's nothing but an acronym for the Center for Higher Educational Achievement. Normally, when we engage on this radio show, we basically speak about our Adult Literacy Center, but we've added another facility onto our Adult Learning Center in order to answer some of the needs that we've had from our students, and come to find out it's needs that the community need. So one of the programs that we offer is free legal counseling services. If you are a low to moderate income resident, you're able to receive free legal counseling services. You may have issues with fair housing. Fair housing is that you may not be treated fairly when you're trying to rent a location, or you may be having some problems with your landlord. We also have like state benefits. If you are applying for state benefits, you've been denied, or if you're not sure if you qualify for them, you can speak to one of the attorneys there on staff. Also, not fair housing, I already said that, family law. There may be some custody issues. There may be some child support issues that you may be facing. You're able to receive counseling and possible representation from attorney free of charge. The only thing that they don't provide is civil criminal representation. But if you are a senior over the age of 60, it doesn't make any difference what your income level is. Any services that you need to talk to about attorney and possible representation is totally free. Another program that we have is a community outreach program that helps adults obtain their driver's license, social security card, medical copay, and bus passes. Those are some critical things that we notice a lot of residents do not have. And some of those things are important in order for you to, like Dr. Reynolds was saying, if you need to make sure you have your medicine over the holiday. If you don't have the funding for it, we can possibly help you with those copays. If you don't have the transportation in order to go certain places, we can help you with that transportation. Another program that we have is something that we talk about a lot is mental health. And so we have a partnership with the name of the therapist is Rich Give Family Solutions. And we're in partnership with this therapist in order to provide mental health services. So she specializes in family and couple counseling, and she does individual counseling. Coming up in January, we have two wonderful programs that are coming up. One is for seniors. It's going to be our basic computer and financial literacy program. That's a partnership with Flagstar Bank. We're finding that seniors over the age of 60 are having more financial problems than ever before. In the city of Flint, we come to find the second impoverished population in the city of Flint are seniors 65 years of age and older. And as they become older, they become more impoverished due to poor financial planning. The next program we're going to be having also starting in January is a financial literacy program for adults 25 to 59 years of age. That's a partnership with the state bank. We're in the process of developing that program to be able to offer that one. It's not January. That program is in February. Because I told, when I had a conversation with the representative with the state bank, I wanted to be more forward-thinking in our financial literacy programs when we work with adults 25 to 59 years of age. Financial currency is changing, and therefore we need to teach our people how to advance, how to move forward in their lives, because a lot of us, I should say a lot of people, aren't prepared for what's going on. We know about this digital currency. If you read the newspaper, they're talking about possibly putting our security on the internet and making it for a form of stock exchange. So people need to be enlightened about those financial what word can I say? Financial changes that are going on. And our Community Resource Center is here for the residents, and we're looking forward to 2022. Can you believe that's coming?
Yeah.
To be able to help residents with all these programs and services.
No, Dr. Stozier, this sounds outstanding. I was trying to write as you were talking also, and we'll make sure that we put some links up, because these are the kinds of resources that people need. You know, so many people need some support around. Yeah, you know, around some of these financial supports, these educational supports, and then the mental health is so critical. You know, we focused a lot on physical health during this pandemic, but people's mental health is as important. You know, a broken heart or a broken mind can be as damaging to one's life as a broken leg. So, you know, just bravo and really appreciate you. Can you just one more time for the people on the radio, give them the number they could call if they want to find out, or what website they could go to if they want to find out more about how to access these great resources at the Chia Community Resource House?
Yes, our phone number. Always remember now, we have to dial our area code 810-877-6308. Again, the number is 810-877-6308. If you're interested in viewing our website, it is www.m is in Michael, Y is in yellow, C is in cat, H is in helicopter, E is in elephant, A is in apple.org. That's mychia.org. You see, I do that a lot.
Right. You got the protocol down. You know how to run it down for folks. All right, that's great. So go to www.mychia.org if people want to check it out online. Thank you for providing all that great insight and information. Okay, so this, all right. So y'all, Dr. Reynolds, you said you wanted to put a quick correction in. You wanted to correct the phone number for our folks on the radio and our folks online. We still got you, Dr. Reynolds? Uh-oh. All right. Well, he corrected a number that he left for us, 810-743-9048, for the resource that Dr. Reynolds referred to during his segment. So I want to go over just a couple of things. And for the folks that are on Facebook Live, you missed the very opening of this, which we opened with a prayer and a word for both Mayor Neeley and Representative Cynthia Neeley, who are both dealing with the transitions of their parents. Both of their moms have been very ill over the course of this year, and we want to just keep them both lifted up in prayers. They both raised their hands to be servants to us, and so I just ask that people, you know, send out their good prayers and their thoughts be with the Neelys as they weather this season as well. I think we all can understand. It doesn't matter who you voted for, what your political affiliation is. I buried both of my parents more than 10 years ago. And I will tell you, just the love and the thoughts and the prayers and the support that I received from people made that transition a lot better for me. So let's just please do keep the Neeley family in prayer during this season. We've got some exciting things happening in the city. We've got a vaccine clinic that'll be coming up this week, vaccine clinics this week at the mini stations. The first one will be on Tuesday, December 14th from 2 to 7 at 2 to 7 at the Northeast mini station on MLK. So that's going to be a special pop-up vaccine clinic connected with the new mini stations. You can call the Genesee Community Health Center if you want more information about those. Tuesday, December 14th, 2 to 7, Northeast mini station on MLK. You call 810-496-5777 to find out more about that. And I just want to thank and acknowledge the city for the great work in continuing to ensure that access is not a problem for people who want to get the vaccine as a measure of protection during this pandemic. We've also got some really exciting updates coming from Mayor Neeley, and you will be hearing from him directly in his next State of the City address. That is also happening on Tuesday. We'll just call it Big Fat Tuesday because there'll be all kinds of good stuff going on. And that's going to be also on Tuesday, December 14th at 7:30 p.m. will be the State of the City address delivered by Mayor Neeley. You can tune in on Channel 17. You can also join right here on the City of Flint's Facebook channel, and you can hear it Facebook Live, and it will also be on YouTube Live. Again, that is the State of the City address that will be delivered by Mayor Neeley again on this Tuesday. Last announcement that Mayor Neeley wanted me to make for you all today is there's been a whole lot of buzz around these ARPA dollars, right? And we love money. We need money. My mama used to always say like that things don't run on good intentions. So we've got a pretty large allotment coming in from the ARPA dollars. As somebody who's received some of those dollars, not the city's dollars, but as somebody who does research, and I've received federal research grants that include some of this money, and I had CARES Act money, I can tell you compliance with the spending of those dollars is critical. We got CARES Act money in Flint that came through from the state and that came in through the Community Foundation of Greater Flint last year. We turned that money around very quickly and rapidly deployed it in community. If you do not spend that money as per the guidelines that are laid out, if there's any non-compliance around how those funds are spent, you are obligated to pay those funds back to the federal government. Now, can you imagine we are spending money to get the resources and supports and services that we need in place, and then we are then having to pay those monies back? We don't want to do that. What you absolutely have to do is make sure that you understand all the rules and the regulations and that you've got all of the checks and balances in place in advance of any money being spent. Any money being spent. Agencies are required to do audits. You must have compliance so that we will be contracting with a compliance firm to ensure from jump that those monies are spent in accordance with the ARPA regulations. It will be monitored ongoingly. This is called responsible stewardship. Remember, these are new dollars, and it is complicated. And we have had examples from CARES Act money where states and cities made mistakes in how they spent that money. We do not want that to happen here in the city of Flint. And the good news is we have checks and balances in place. So none of that money, including a compliance firm, will be spent without a public process and without city council approval. So just know our government is working as designed, and it is currently in city council awaiting city council approval. But the mayor asked me just to speak on that and really underscore the very important need that we have for compliance checks and a compliance firm to ensure that how we spend those ARPA dollars cuts mustard and is in line with the intention, and we will not be in harm's way nor required to pay any money back. So those are our critical updates for today. I'm going to turn it back over to our guests and ask Dr. Stozier, is there anything else on your heart, on your mind, anything else you'd like to leave with our listeners today? We've got listeners both on Facebook Live, and we've also got listeners that are listening to us on the radio. And I'm sure there's somebody under the sound of my voice that needs to hear what you would like to share.
Yes, we put a lot of our programs and services together because of the residents of Flint we work with at our Adult Literacy Center. We do come to find that everything that we provide, these are needs for residents of the city of Flint. And a lot of the residents aren't participating in a lot of the services, but we're getting more people outside of the city of Flint that's coming for the services. It's the same thing as you state when it comes with a lot of federal dollars that come into the city of Flint. Flint residents, there's a lot of programs and services that are here for you. They say a lot of bad things about Flint, but Flint is the hub for a lot of programs and services. We have more people who come out of our area and come into the city of Flint, and they get these resources. Residents, please take advantage of any type of programs and services that are here that is offered for you. It doesn't have to be from our organization. Whatever organization is providing resources for you, because we do the research based upon you. So please, open your eyes, pay attention, read for yourself. And if there's any programs and services that are available for you, Flint residents, please take advantage of them, because just like she stated, if we don't utilize these dollars, we do have to turn them in. It doesn't make any difference if it's from the city of Flint. For myself, if I don't use grant funded money for the residents of the city of Flint, who I have written grants for based upon the needs that we have identified, if I do not spend the money like I'm supposed to, we have to come over. And then by the time you come and ask for these resources, we can't provide them because you didn't utilize them in the beginning. So residents, please, 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 I urge you, any programs that come into your neighborhood, into your city, participate in them, because residents outside of the city will come in and take your resources.
Yes, and we don't want nor need that. We call that plunder. People coming in and extracting from us for their own gain and benefit. And we are not in a position to be able to afford that. We want our residents to be the beneficiary of our resources. So thank you for that, Dr. Stozier. That's an important point.
You're so welcome.
Yes. Okay, we're going to bring this to a close. And I just want to encourage people, because, I'm your, public health champion, and I do my best to bring good data to you all every week. We produce something through the Flint Center for Health Equity Solutions called the COVID-19 Health Equity Brief for Genesee County and Flint. If you go and check that out, you'll see that, in fact, the numbers are rising, and our vaccination rates, unfortunately, aren't rising at the same pace in which cases are rising. So I do encourage everybody during this season, please be safe, get your vaccine, get your booster, make sure you make an appointment with a primary healthcare provider. If you don't have one, reach out to our wonderful partners at the Hamilton Community Health Network. It is their job as the federally qualified health center to be the stake in the ground for people in this great city and in this great county, and to make sure that everybody has access to a primary healthcare provider. I always tell people, you are the captain of your own health team, but a good primary healthcare provider is a partner. So to the WFLT family, we say thank you. To all the Facebook Live listeners, thank you. Sorry about the little glitch earlier. And to the Neeley family, we are keeping you and your whole family in our thoughts and in our prayers. Everybody be blessed today and always. And thank you so much on behalf of the City of Flint.
Thank you for tuning in to the Community